Having our routines altered during this period of changing school and physical distancing guidelines can have an impact on everyone, but it's especially difficult for children with developmental disabilities or complex needs. Unpredictability can really affect children who rely on routine, and parents can feel out of their depth trying to manage and explain to their kids what's happening in these changing times. Thankfully, there are things we can do to help. Today we have parenting and family psychology expert and founder of the Triple P Positive Parenting Program, Professor Matt Sanders, and disability services expert and senior lecturer in clinical psychology from Curtin University, Dr. Trevor Mazzucchelli, on the show to share some tips for helping children with diverse needs navigate these uncertain times.
Our daughter hates it when her routine's disrupted. She hates change, but it's hard to prepare her when everything is so unpredictable.
I've got 2 kids with autism and they're really struggling with it. Have you any ideas how I can help with that?
The kids don't really understand what's going on, but I know they're upset.
This whole time has been so stressful. My boy is high risk because of his health, so I don't want to take him out at all.
We all know how unsettling this time has been for so many of us as adults and for family life in general. It's also been a time that's been pretty difficult for some children, particularly children with developmental disabilities and complex needs. These include children with ASD or autistic spectrum disorders, intellectual disabilities, physical disabilities, hearing and vision impairments, and children with chronic health conditions. It's so much harder for children when they don't understand or are confused about what's going on around them. They may not be able to express their feelings or concerns or ideas because of communication difficulties. They may also have trouble calming or self-regulating emotions, which sometimes to parents can look as though the kids are acting out or being aggressive. And of course, children may have experienced the disruption to their regular therapies, speech therapy, physical therapy, the kind of rehabilitation work they've been doing, or their usual home care or supports. Now, Trevor, when you think about parents of children with a disability, they can also have a lot of extra stress as well, can't they?
Yeah, that's right, Matt. Children with a disability may fall into the high risk category when it comes to COVID-19 due to other health conditions they may also have, things like cystic fibrosis, for instance. Many children with disabilities require medication, PPE, personal protective equipment such as gloves and masks, home care, respite, and rehabilitation services. And parents, they've certainly been concerned that essential resources may be unavailable in some communities. Things such as PPE shortages, delayed or cancelled dispensing of medical equipment, cancellation of respite and group programs, and the potential for staffing shortages in respite services and other services. Physical distancing may not be possible for children who require therapy or assistance with daily tasks such as dressing and bathing, and there is the concern that it may be difficult to obtain important medical supplies.
So, given all of these things that are going on, it's pretty understandable, I think, that parents may be experiencing a range of uncomfortable feelings and emotions. So, these can include anxiety and anger and sadness, as well as an uncertainty about what to do and how to cope with the current situation that they're dealing with. So, it's important for parents to really start to focus on how to look after themselves first so that they're able to support their child navigate these challenging times. And really, one of the most basic things of all is how to remain reasonably calm and as comforting as possible in all of our interactions with children.
I just kept saying to them that, we're your parents that keep you safe and are here to protect you. We're going to stay all together, we're going to keep all together. And that was, I guess, comforting for them to know that. that that's what we were going to do.
If we get out of our usual routine, it's really hard to get back.
So what can we do to help children in times like these? Trevor, you spent many years working with families of children with disabilities. Can you share any sort of tips that you think are important for parents to think about at these times?
Yeah, sure. I think it's important that parents communicate through their actions and their words that it's our job as our child's parent to do everything within our power to keep them safe, and that this is precisely what we're doing. We can use this as an opportunity to review the concrete ways that we're ensuring a safe environment. For example, just as seatbelts keep us safe, so does washing hands. Calmly explaining these things will help our children to feel safer and to better understand why we must observe restrictions, such as not standing too close to others. And as we have these conversations, it's useful to know that some children may benefit from pictures to help them understand the things we must do to stop germs from spreading.
Okay, so as much as possible, I think we also need to focus on this issue of creating a sense of predictability and routine and certainty. How important is that, Trevor?
Yeah, it's really important that we stick to usual routines like meal times and bedtime routines as much as we can. It's a good idea to involve children in setting up routines like more regular washing of hands and keeping more distance than usual between ourselves and others if we're outside of the home. And also, if we're still working from home, routines for managing that when children are at home also. Some children find it easier to adjust to changes in routines if they're involved in planning these changes. However, even if you do involve them, you can expect that some changes will still result in distress or arguments in the short term. It might take a little bit of time for a family to adjust to these new routines. So I think it's important to be kind and patient with both ourselves and our children as much as we can. A daily timetable or schedule can help us and our child cope with being at home. And for children who understand best with pictures, you might use pictures representing frequent activities and arrange them in the order that the activities will occur. Now again, the timetable may not go exactly as planned, but that's okay. Having a timetable is about providing some structure and guidance for the day. And when things don't go to plan, just be patient with yourself and your child and work together to think about how to make it work better the next day. Perhaps a different order of activities or scheduling more breaks.
I think the kids do pick up on our worries and anxieties, so we really are trying to stay calm and just keep everything as normal as possible.
And we can also help children cope with their own emotions and to learn to tolerate a bit more uncertainty in this more unpredictable world. What are your thoughts on that, Trev?
Children may misdirect anger or frustration towards parents, and we need to recognise that if this happens, we need to listen and support all the feelings that are expressed. And when your child does want to communicate their feelings, I think it's important that we as parents stop what we're doing and give them our full attention. We need to avoid telling our children how they should feel, things like don't be silly or you don't have to worry about that. Instead, let your child know that it's okay to be worried or sad or angry or disappointed. Drawing can be a good way for children to express their concerns and also for parents to support conversations. Also, through our actions and words, we can demonstrate acceptance of uncertainty to our children. So, for instance, we might say, we don't know when this is going to be over. I know it's hard not to know. We have to remind ourselves that we're doing our best to stay safe and well, and that the whole world is working together on this. I think we can also schedule coping and calming activities into your child's day and consider ways to learn new calming skills such as slow breathing or muscle relaxation.
Some of these skills I think will be very important for kids to realise that it's something that they can do that enables them to have a bit more control over difficult and challenging feelings that they're having.
He's made huge gains since therapy started, and I don't want him to slip back. But I don't know, how can I avoid that?
We also at times like this need to make use of the supports that are available to us. Trevor, what would your advice be here?
Get advice from your child's teachers, therapists and healthcare providers. Ask about how their services may be changing, such as whether distance or online services are available, whether they're changing back to in-person sessions. If your child can't attend their usual day placement or therapy services, find out what activities are recommended over this period. Also, if your child has a short or long-term health condition, talking with your child's healthcare provider can guide decisions about how to manage their conditions and access any needed equipment or medications or other supplies.
And of course, a key message here really is to take care of ourselves as parents. I mean, we need to look after our own needs for relaxation and downtime so that you can actually stay calm and be more consistent and available to your children. I think it's often a good idea to just be able to accept that some things you simply can't control. This actually helps us to reduce our anxiety and stress. Don't spend too much time worrying about the number of cases of coronavirus or whether people will develop a germ phobia because of hand washing too much or when we'll be able to shake hands again and things like this. Focus on what you can control, like how to plan your day, how to spend your time, what to give priority to, who to make contact with, goals you set for yourself and for your child on that day. And then you can make changes that are helpful for your family. So in summary, help your child reach out and connect with loved ones that are important to them. Big changes to children's lives can be hard and often scary. They can also create opportunities for learning new skills. These include different ways of communicating with friends and loved ones. If you have serious concerns about your child's emotional health, be prepared to seek professional assistance. So Trevor, just reflecting back on what the community has been going through, do you have any final thoughts for parents out there of children with a disability?
Well, Matt, these certainly are unprecedented times. And despite the challenges that are here at the moment, I think it's reassuring to know that children with disabilities and parents are remarkably resilient, and we will get through this.
That's all we have time for in today's episode of Parenting in a Pandemic. Let's just run back over Matt and Trevor's key tips for supporting children with diverse needs. Tip number 1, let your child know it's your job as their parent to do everything within your power to keep them safe and maintain a sense of routine and predictability in their lives. Tip number 2, help your child cope with their feelings and learn to tolerate a little more uncertainty. It also helps to schedule coping and calming activities into their day. Tip number 3, use the supports and services available to you. And tip number 4, don't forget to think about your own needs and look after yourself too. Thanks for listening to Parenting in a Pandemic. If you're enjoying this podcast, make sure you like and subscribe wherever you get your podcasts. And don't forget to leave a review, it'll help others to find this series. You can find free COVID-19 Parenting in a Pandemic resources in the episode show notes to help you on this journey.